Thoughtful Connections, a memory care podcast, aims to provide general information and insights about dementia and related topics. The content shared is not intended to be medical advice or a substitute for professional medical or clinical guidance. The purpose or goal of this podcast series is to help inform and educate family members considering memory care for a loved one. Coming to you live from the Haidee and Allen Wild Center for the Arts on the Cottey College campus in Nevada, Missouri. With us, as always, is Elizabeth Thompson, Arrow Senior Living Senior Regional Director of Memory Care. Welcome. I'm Charlie Johnson, your host. Well, greetings, Elizabeth.
Hello, Charlie.
Yeah, it's great to see you. I see that we have a special guest with us today. Would you do the honors and make an introduction?
Of course. Welcome, Julia. Julia Baechle is an occupational therapist with more than 12 years experience specializing in the care of older adults across outpatient, assisted living, independent living, and memory care settings. She earned her master's degree in occupational therapy from Maryville University in St. Louis. She is an active member of Advion, the National Association for Rehabilitation Providers and Agencies, and the American Occupational Therapy Association. Julia stays deeply engaged in professional advocacy and clinical best practices. For the past 8 years, she's been a key member of the EmpowerMe Wellness team, where she now serves as Vice President of Clinical Quality and Support, leading initiatives that elevate outcomes and support clinicians nationwide. Julia also lives in St. Charles, Missouri, with her husband, their son and daughter, and their family's golden retriever, who I got to see a picture of last night and is super cute.
Oh, welcome, Julia.
Thank you.
That is quite the bio. We're so fortunate to have you with us here today. And thank you for joining us here for Thoughtful Connections. I know you had quite a drive coming down from St. Charles, and I understand this is your first time to be in Nevada. And you actually learned that Nevada existed. Is that correct?
Yes, this is my first time here and learning all about Nevada. Happy to be here.
Well, that's
Thanks
great.
for having me.
Well, we're so fortunate to have you. And of course, we heard your bio, but if you would tell us a little bit, about your background as it relates to dementia and memory care and healthcare in general.
Sure. So as you mentioned, I graduated with my master's degree in occupational therapy in 2013, but that's not really where I got my start in senior living or memory care. Through college, I worked for a small local company in St. Louis as a therapy tech or a wellness coordinator, and my job really was to travel to different senior living communities and teach wellness classes, exercise classes, and that's really where I found my passion for older adults. I all through school, I thought that I wanted to work with kids. And once I got into the senior living communities, I realized how much fun these seniors are working with. So as soon as I graduated, I was really fortunate to get my first job in an amazing senior living community, memory care community, that was partnered with CPI, Crisis Prevention Institute, and modeled after Claudia Allen's theory. And so that's where I was able to get an early start learning all things about dementia, assessment, treatment, and I just, I fell in love with memory care. So fast forward to 2017, started with EmpowerMe Wellness. We were just one small, we were in one clinic, very small startup company. And I started as a treating therapist. And from there, I was able to grow professionally with the company. And as you mentioned, now I serve in more of a centralized support role as the Vice President of Clinical Quality and Support.
Awesome.
It's a great story. Yeah, you've come a long way.
Thanks.
Yeah. So last year, the Center for Medicare and Medicaid Innovation announced their new guide model for dementia care. For those not familiar with this program, Can you walk us through what that program entails?
Sure. The GUIDE model, which stands for Guiding an Improved Dementia Experience, is a new nationwide voluntary program launched by CMS. So it's intended to be an 8-year pilot. It launched July 1st of 2024. And it's really just aimed at improving care for Medicare beneficiaries living with dementia and their caregivers. It seeks to reduce unnecessary hospitalizations and ER visits, reduce Medicare spending, and ultimately help people with dementia stay in their homes and communities longer. So the program really includes an interdisciplinary, longitudinal approach to dementia care, starting with a comprehensive assessment, a person-centered care plan, caregiver training and support, and just coordination of clinical and community-based supports. Another big part of the program is access to a 24/7 care team.
Wow.
And yeah, which is really amazing. And then respite services as well. So, in short, CMS, GUIDE is their bold effort to reimagine dementia care by blending medical, social, caregiver support, and navigation resources all under one coordinated program.
You'd mentioned 24-hour access. What type of access were you talking about there?
So we at EmpowerMe Wellness, we have a 24/7 support line. So caregivers, whether it's a family caregiver or caregivers in a senior living community, can call this number at any time. And it will be answered by one of our care navigators or physicians, nurse practitioners, and just be able to answer any of your questions. We also we have a virtual provider team. So our dementia proficient physicians and nurse practitioners are available to hop on a virtual call at any time during the day, after hours, to help with any of those medical issues, to avoid those ER visits that many times they would have to, visit.
Sure. So can you kind of delve into the eligibility and who can enroll into this GUIDE program?
Yeah, so beneficiaries enrolled in traditional Medicare with a diagnosis of dementia at any stage and living at home are eligible to enroll. Any residents living in a long-term skilled nursing facility or enrolled in Medicare's hospice benefit are not eligible to enroll.
Okay.
But enrollment's voluntary. The person must consent to be aligned with a GUIDE program. And it's also important to note that enrolling in GUIDE does not require the beneficiary to give up their existing provider. So they still maintain access, flexibility to see their non-GUIDE providers.
Okay. Well, I know I see EmpowerMe in our communities all the time, and I love them being there. But can you tell us what the GUIDE model looks like at the community level for residents with dementia and their families?
Sure. So the GUIDE program is really meant to transform how care is delivered in the places where people with dementia already live. So whether that's at home or an assisted living community, a memory care community, or another residential setting. So while GUIDE has very clear care delivery requirements, each program is going to look a little different. So I'm going to speak specifically today about how the program is delivered through EmpowerMe 360 with EmpowerMe Wellness. So enrollment really starts with our on-site clinical teams. They conduct a holistic, comprehensive assessment, including cognition, medical comorbidities, their functional abilities, their behaviors, psychosocial needs, safety, their environment, things like that. So that comprehensive assessment is then reviewed by one of our dementia proficient physicians or nurse practitioners who take that information and develop a person-centered care plan, or what we call a wellness plan. That resident is then also assigned a care navigator. So that care navigator then becomes their go-to contact for coordinating services, navigating resources, answering questions, and linking to community supports. So then from there, the interdisciplinary team conducts regular wellness touch points with the residents and their families, providing education, and just, all of the things that are based on the goals outlined in their wellness plan. Okay. And then, the care team is also going to conduct regular assessments to collect outcome and quality data on falls, hospitalizations, ER visits, and quality of life. So, because EmpowerMe Wellness is in senior living communities, that means embedding a guide care team within the community. So we're integrated with existing staff, supporting residents and their families proactively rather than reactively.
Mm-hmm. That's what I've loved seeing, is just the interaction between the existing staff and the EmpowerMe team.
Yeah.
I've heard you mention dementia proficient physicians. I've heard that 2 or 3 times.
Yeah.
Expand on that. What makes those physicians dementia proficient?
Well, we do offer at EmpowerMe Wellness, when a physician or a nurse practitioner starts, we arm them with all of the information they need, all of the training they need, if they don't already come to us with that specialization in dementia. And then it's actually part of the CMS guide requirements that all of our physicians, nurse practitioners, and care navigators get an initial 20 hours of training specific to dementia and care navigation.
Okay.
And then, annual training from there.
Okay. So I know that EmpowerMe Wellness, that you are unique in senior living because, you're fully integrated as a service provider. You offer therapy, pharmacy services, medical services, and care coordination. You're kind of a full service, a full meal deal, aren't you? Yeah. So how has that informed your approach to providing services under the guide program?
Yeah, I just have to say, when CMS announced the guide model, we were thrilled for the opportunity to participate because EmpowerMe Wellness was really founded on the idea that healthcare could be delivered in a better way to seniors, a more accessible and a more coordinated way. There's so many gaps in healthcare for seniors. Especially in senior living, a resident may have multiple providers. They have their PCP and they have their specialists and they may have a therapy team, and you might have home health and a podiatrist, and none of them really seem to talk to each other. And so it really relies on the community staff or the families to make sure that care is being coordinated and communicated. And so when EmpowerMe was founded, Josh Stevens, our CEO and founder, really his goal with starting EmpowerMe was to fill those gaps and to create this healthcare ecosystem within senior living that was just, it delivered a more seamless experience. So as we started EmpowerMe in 2017, we started primarily as a therapy company and then continued to add service lines as we saw the need and opportunity. So, needless to say, guide aligned with our mission and vision. And so our integrated model gave us a strong starting point for participating in the guide model. As you mentioned, we already house on-site therapy, medical services, pharmacy, care coordination under one roof. So it really promotes interoperability and reduces fragmentation. Information flows more easily between disciplines. And, with that infrastructure already in place, we didn't need to build everything from scratch. It helped accelerate our readiness for the guide program. So for residents in a community and at home, it just feels more of a cohesive experience rather than bouncing around between different providers. They access those coordinated services. So for example, our medical group may flag medication issues that can inform a therapy plan of care. And then, of course, therapy feedback can help inform medical decisions as well. And so by sharing that information, our integrated team can, really just act quickly and it's just a more seamless, coordinated experience for those residents and their families.
I love that. Tell me a little bit more about the data that for these residents that's being collected using the GUIDE program.
Yeah, so data and accountability is really central to the GUIDE program. CMS is evaluating the model success on multiple fronts. So all participating providers are required to report on a set of quality measures, and some of those include healthcare utilization, total cost of care, quality of life for the person living with dementia, satisfaction with care, symptom management, functional abilities over time. And then we also collect data on caregiver stress and burden. And so at EmpowerMe, we're also collecting additional data points from our integrated systems for our medical group, care coordination, therapy, and pharmacy. And that our amazing business intelligence team helps prepare reports, and that really allows us to analyze, how the outcomes and helps with continuous improvement for our program. So we've already seen some really amazing outcomes within the first year of participation. We've seen, compared to the senior living national average, our residents enrolled in the GUIDE program, we've seen 45% less falls. Wow. And 54% less ER visits and hospitalizations.
Wow. That's huge.
And then really just yesterday, I was reviewing some CMS claims data, and we actually saw a 42% reduction in hospitalizations in our enrolled residents compared to their pre-enrollment numbers.
Goodness.
So we're seeing already within the first year, this is a really impactul program.
Yeah, that's some big numbers.
Yeah.
One of the biggest issues that communities see is burnout, turnover, of caregivers, especially in dementia care.
Yeah.
And so what kind of potential impact does this program like GUIDE or EmpowerMe, what kind of impact do you see for operators and for their teams?
Yeah, you've touched on a really important aspect of dementia care, the burden of staff and family caregivers. So programs like GUIDE and EmpowerMe 360 have real potential to alleviate the stress and the burnout, improve retention, improve workflows of those caregivers. So GUIDE and EmpowerMe 360 really encourages early intervention and continuous support, helping to prevent crises that spike stress and turnover. When staff see fewer emergencies and less hospital transfers, lower acuity swings, the work just becomes more manageable. So like I mentioned, the residents and caregivers have access to that 24/7 support line, as well as daytime and after hours virtual acute visits, to just help the staff get things handled more quickly and efficiently. Our care navigators and care coordinators provide training to caregivers and staff on dementia care best practices, behavior management techniques, communication strategies, safety, and self-care. So that really helps the staff feel more confident, capable, and just being part of the integrated program, including the staff in the communities. It becomes the role of managing the care is more of a shared role between EmpowerMe Wellness, our clinical team, and the caregivers, so that we can take some of that burden off of them. Allowing them to focus on the things that really matter.
That's one of the things that I've enjoyed seeing. And I think from a caregiver perspective, whether you're a caregiver in a community or a caregiver at home, anytime you can get additional help, that's such a benefit.
Certainly.
And
we've talked about this often, Elizabeth, about especially caregivers at home.
Mhm.
It's a 24/7, 365.
Yeah.
And oftentimes we see those caregivers burn out. We see them become ill.
Mm-hmm.
We see them oftentimes go before the individual
Mhm.
with dementia simply because they don't take care of themselves. They don't have the self-care, and they don't take time to ask for help.
Yeah.
And we see that often, and we talk about it often.
Mhm.
And so certainly, if we can get folks at home to take advantage of this, it'd be a wonderful thing.
Yes, I agree. One thing I'm not familiar with, though, is the respite program through EmpowerMe and Guide. So could you tell us a little bit more about that?
Yeah. So the respite care is a benefit of the Guide program for individuals aligned who have an unpaid caregiver. So that's, think a family member or a friend, kind of what you were just speaking to,
Mhm.
someone at home that helps with activities of daily living or even instrumental activities of daily living. Even if they're in a senior living community and they have help with their ADLs, they still have someone who is managing their finances and coordinating their healthcare and all of that. So the respite services are just an additional support. There is an annual cap allowance that an individual and their caregiver can use to just provide that respite care to give that caregiver a break and
Wow.
still know that their loved one is being cared for and safe.
Good.
We've talked about a lot with the Guide program today, but how can our audience members learn more about EmpowerMe 360 and the Guide model if they're wanting to dive even deeper than we went today?
Yeah, well, if they are, if you're a resident or a family of a resident in a senior living community in which EmpowerMe is the on-site provider, I really would encourage them to visit our wellness clinic and chat with one of our staff members or clinic directors. We do also offer the Guide program for people still living at home in the private residence. So they can reach out to email 360 at empowerme.com. And then for anyone else, visit our website at empowerme.com. Look for our EmpowerMe 360 page, and there's all kinds of information about our approach. Learn more. We have lots of amazing caregiver resources on there too, for the people who might not be ready to take the leap.
Well, great. Great information. So, Julia, do you have any final thoughts you'd like to share about either the Guide program or EmpowerMe?
Yeah. I just think that the Guide program is such an important step forward in how we care for people with dementia. It's not just about the medical care. It's about the dignity, connection, and supporting through what can be such a tough journey.
Mm-hmm.
And I don't know that I mentioned this earlier, but for Medicare beneficiaries, this is a benefit that has zero out of pocket cost. So I really encourage
huge.
people to take advantage of this. And being part of this effort is really meaningful. So we're EmpowerMe, all of us at EmpowerMe are super excited to help shape what better dementia care looks like in the future.
Great.
Awesome.
How about you, Elizabeth? Do you have any
No.
final thoughts about these programs?
I just want to thank you for being here and shedding more light on the Guide program. I think it's something that so many people aren't even aware of. And like you said, it's a zero out of pocket for extra support.
Yeah.
Who doesn't want that, right?
Well, Julia, we want to thank you for a great presentation. Very insightful on both EmpowerMe as well as the Guide program. We really appreciate it.
Well, thank you both. Thanks for having me.
Great. And thank you all for sharing your time with us. At Arrow Senior Living, we believe in the power of a chuckle, maintaining a childlike sense of wonder, and defending the dignity of others. Until next time, this is Charlie Johnson with Arrow's Thoughtful Connections, a memory care podcast, wishing you fond memories filled with moments of joy. And remember, if you've met one person with dementia, you've met one person with dementia.
You can find Thoughtful Connections, a memory care podcast, anywhere you listen to podcasts.